Thank you, Lawrence. Make sure. Okay, thank you. The judge and I wanted to have this press conference to let you all know that today we had 3 cases of the Delta variant reported within our community. It was three females, ages 20, in the 40s, and the other one in the 60s. All 3 of them were not vaccinated. So that's really important, and we want to have this press conference as we've noticed that around the country, as you've seen the cases of the Delta variant and the virus going up, we want to make sure that we become proactive, and we ask our community, as you've seen the CDC, the President of the United States has asked people to wear a mask and continue to wear a mask. The Delta variant is very, very contagious. It's been described, it's more contagious than the chicken pox. And so we do want to let everyone know that we knew that we would have it in our community. So we wanted to let everyone know that we have reported it, and we want to make sure that everyone understands that wearing a mask, social distancing, it's still, and sanitizing your hands is so important, more today than it's ever been. And as I said, that it's okay to wear a mask. It's okay to be the only one in the room with a mask because you're saving your life and your loved one's life. And I can tell you, I went to a deal the other night, and there was probably 50 people there, and I was the only person wearing a mask, and I'm okay with that. I'd like to turn it over to the county judge, as we're very concerned for our community, and we want to make sure that we do not go backwards. We remember October, we remember November, and those are the days we don't ever want to go back to. Judge?
Thank you. And as you know, we've always been like 12 to 15 days of anything that happens around the country or in Texas, in Austin, in those areas. And so that's our trend. And you know where San Antonio is and the saturation of the hospitals and all that. And the mayor and I are extremely concerned, him on a personal level, of what he's had to deal with COVID and his own family and the deaths. And myself just watching the pandemic, evolve and all the difficult challenges and dealing with the families and so forth. And also, our heart goes out to our teachers that are coming in. They're going in to school, and the kids are going into school. So we know it's going to be a very difficult situation. And just want to remind you that when it's not mandatory to wear masks, doesn't mean that you're not going to wear a mask. And parents have asked me, well, I can't wear a mask. My child cannot wear a mask. I said, no, he can wear a mask. It's not mandatory to wear a mask. And we're really asking that the children do go wear a mask, that they practice during the week before they go into school next week, and try to get used to that. One of the things that's really difficult is peer pressure. So if you're the only one wearing a mask and you're a young child, it's very difficult. So the more the parents work together and PTAs and so forth work together, that all the kids wear a mask, it's a lot easier on them because of the peer pressure. I did reach out to the superintendent of, Xavier de la Torre, and wanted to support, the mayor and I will be obviously supporting that the school boards have the opportunity on their own to determine what they need to do and what they do not need to do on their school districts. And so there's very little we could do. All we could do is encourage that the school boards and everyone else find ways and signage and everything. You can wear a mask, wash your hands, make sure that you go forward in the right way. So we're from a very vulnerable community, and that's what hurts a lot because that virus quickly spreads. And as you saw, the number of people that had underlying conditions and ended up in the hospital. So once again, this is our way, our plea to our community, that we really need to be prudent and that we don't want to go where we came from. I don't think anyone here wants to go. The other thing, I'm going to be pretty open about the fact that there's a big festival in Juarez that's happening. It's, I've been there in the past, and there's going to be a tremendous amount of El Pasoans that will want to go to that the festival that's coming up in Juarez. We don't want to discourage anyone other than could be a really challenging situation if people from El Paso go into Juarez and come back where there's a lot of vulnerability and less people are vaccinated. So those are the kinds of prudent things that we want to make sure that you take into consideration. Thank you, and thank you for your prudence, and thank you for your community We know how to do this, okay? We know how to take care of this problem, and let's do it. Let's get back as a community.
Now, out of the three cases, one of them is travel-related, and that's one of the things that we've been talking about, that travel-related, when you leave the city, you leave the state, or you even leave the country, you go to areas where maybe higher opportunity to catch the coronavirus. You know, someone told me yesterday, and I thought it was very well put, that the coronavirus today is looking for a sponsor, and that's someone that has not been vaccinated. And they can, of course, transmit it, and it's so easily be transmitted. I was looking right now at some of the data and the figures that we see from last week, and the hospitalization rate in El Paso has gone from 50 the prior week to 68, which is a 36% increase in hospitalization. And that's because people are starting to feel very comfortable not wearing a mask. They're starting to feel comfortable going to the areas. And as you saw the CDC and the president state that know your surroundings. And if you go somewhere where it's a high area where you may be susceptible to anything, please wear a mask. And I think people are getting a little bit comfortable with it. And it's important that we know our surroundings. We'll open it up to a couple questions. Anybody have a question? Please.
Yeah, if we could just talk about that first Delta case. You know, when was the first one officially reported here in El Paso? And do we know if that first one is related to travel, or was this a native El Pasoan that had it already?
Well, when we called the news conference, I'll tell you that, and that's where it's really important. We called the news conference at around noon, and we talked to Ms. Cruz Costa to put this together. We had two cases, and one of the two cases, and we don't know which is the first or the second because they were both reported at the same time to us, was travel related. By the time, which was at 2:18, I got an email saying that we had the third reported case. So it's out there, and we need to make sure we know our surroundings.
This one goes for the county judge. I mean, obviously, we've seen the saga that unfolded last year when you were trying to implement health protocols and the governor was not allowing you to do that. Any frustration about, possibly wanting to put mandates together to have El Pasoans be, forcing them to wear masks and not being able to do that? How do you just feel about, reporting these Delta variants and possibly knowing that there's not much that can be done in terms of mandates?
Well, we've made a decision, and it's very clear that we were not very efficient, and we wasted a lot of time trying to convince someone else about our community. And what we do now is just we plead to the community to help us. That was a solution. As you remember, 2 months later, we're still wearing masks. The numbers went down. That was more powerful than any mandate that we had. And so I think there's some trusting voices. I hope that I'm one of them. I know that our mayor's a trusting voice, and I think that's what we're going to do. We're just going to keep pleading to our community, give them the stats being, almost 75% of our cases now have to do with unvaccinated individuals. So we're going to give them as much information. We found out through studies that the grandparents are very powerful in our community. So we're asking the grandparents to speak up and deploy that authority that they have and that love that they have. So we're trying everything that we can, but the mandates really take a long time and distracting, and then we create a fraction in our department or in our community. And that's what we've learned. We just have to go to our community and reach out to them.
That's important what the judge is talking about, that even though the governor back in March said, you don't need to wear a mask, and that we couldn't mandate masks, we didn't. We went to the public. We went to the community and said, we want you to wear your mask. We want you to continue to social distance. And you know what? That's how we're able to get to the number we're at today, because the community knew that we didn't want to go back to October. We didn't want to go back to November. And you're right, we don't want to put any restrictions on our community. We're asking the community to make sure they understand their surroundings. Even though today El Paso, we're at almost at 70% fully vaccinated. We're at 80.3% first vaccine, which is one of the leading cities in the nation. And that's why we have not seen the Delta variant in El Paso until today, because the community has done what's right, and we're asking the rest of the people, the 30% that has not been vaccinated, to please get vaccinated.
With the 3 confirmed cases of the Delta variant in our community, is there an estimate about how many people may be infected?
As for how many people would,
How many people may be infected with the Delta variant in our community? Knowing that we have 3 confirmed cases.
well, as we've always said, we understand the same thing that happened in other communities. They get 2, 3, 4, and then because they're not, they're not wearing their mask, or they're not social distancing, it's a virus that is much quicker and faster. The symptoms are not as severe, but it spreads faster. And as you saw, there's 2 of the younger that was very unusual before to have a 20 or have someone at the age of 40. And so it depends on our community. We also know right now there's a tremendous amount. The flu has come a little earlier for us, so we're going to mix the flu. It has been pretty strong. People reporting a lot of having headaches and earaches, and so you don't want that perfect storm. You don't want your regular virus, the Delta virus, and the flu coming together. We saturate our hospitals, and we know how powerful the mask is. And I've said over and over, we had 850 cases of the flu prior to the pandemic and 55 during the pandemic because people were wearing their masks. So I don't know if there's any vaccine mask. I mean, that's the formula, and that's very powerful.
And what the county judge said right now about the flu and the cold, the Delta variant is quite more contagious than the common cold and the flu today. And, continue to wear a mask. There was a report issued today that I was reading that showed that 6,900 people around the U.S. have gotten the Delta variant that were vaccinated. So that's why we plead that everyone wear your mask and social distance. Oh, absolutely. And, we talk about how contagious it is, more contagious than the chicken pox, a lot easier to contract it than that. And it's more contagious than the flu and the common cold. So absolutely, are we worried? That's why we're here today, to let the community know that it's within our community and we need to be careful and understand and know your surroundings.
Yeah, one of the commitments the mayor and I made is that whether, we're not going to hold any information, we're not going to try to figure things out, that we want to put it on the table. And as soon as it came out, the mayor called me and said, we have our first cases, we need to let the community know. And we want to be as transparent as possible. And I think some of the transparency is going to be pretty difficult to take because we will start getting more cases. We will be talking about them, but it's out on the table. And that's what we want to do, help our community understand what's happening.
Well, the way it's being tested, it's at a random. When somebody tests positive, then become random, then they're sent out because the way you're able to detect the Delta variant, it's through genetics, and that's why everybody would send it out and make sure that we get it. And so right now they're becoming all random to see what type of cases we do have.
Well, we're still looking at it, but great information about the grandparents was one of that. The other one is the young adults wanting to, we have to entice them to bring them in, and convenience has been a huge factor. We know that it's not a lot of hesitancy as much as we've been told, if I happen to be driving up and if I happen to get the vaccine. And so the mayor and I are looking at possibilities. What do we do? I mean, one of the biggest challenges is that if we do something big so that they can come together, they haven't been vaccinated, right? And so they come together. When they get vaccinated, it takes 10 days to be able to. So we're thinking, for example, if we had a major concert, but the only way you could get there would be 15 days prior, you would be able to get vaccinated prior to the concert, and then you'd be allowed to go into the concert. So we're looking at a lot of different factors, but as you could tell, we talk a lot about the 20 to about the 35, 40-year-olds, because that's the spreaders. That's happened to us in our community. We've learned a lot. I mean, we learned a lot about what needs to happen. We feel very confident, But if the community doesn't respond, it doesn't matter what we've learned. We still need to make sure that people feel. I mean, we've said some harsh words like, don't be the reason for the next death. I mean, even to that point, if that's what people have to hear, that you could be the reason to the next death, then that's what you got to hear. I mean, this is a lot of tough love that we have to work with our community, but this is where we're at. I mean, we do not want to go back to November. I don't think anyone in El Paso wants to get back to November.
And talking to some of the younger people within our community, we ask them and we say, why wouldn't you want to get the vaccine? And they said, well, we want to make sure that we let the older people in our community get it. And my message to them is we vaccinated over 65, or over 85% fully vaccinated, and over 95% have the first vaccine. So we have plenty of vaccines. The vaccine's available, and we'll make it available for you. So if you're waiting for that, it's time today to go ahead and get your vaccine.
Sí, pues,
por favor, después.
sí, no lo pasen. No, muchas gracias. Estamos aquí porque pues, estamos anticipando, ya tuvimos 3 casos. Sabemos que estamos como de 12 a 15 días de lo que sucede en otras partes de Texas y en el país. Y sabemos que es muy rápido. El virus de Delta es muy rápido, es muy diferente. Se puede contagiar mucho más rápido. Es un poco menos, los síntomas son menos, pero esa persona se lo puede pasar a alguien que está más vulnerable. Sabemos que estamos en una comunidad muy vulnerable. Primeramente quiero decirles que estamos muy orgullosos de que somos los más vacunados en cualquier lugar en el país, pero eso no es toda la protección, porque si hay personas que no, pueden crear una situación donde se va a reversar esas estadísticas, donde nos va a bajar el número de personas que están vulnerables. Les pedimos a la comunidad que no va a ser un mandato, no vamos a buscar una orden del gobernador, vamos a tener que pedirles a la comunidad que responda, porque hemos visto que es la única manera. Cuando usaron la mascarilla 2 meses después que se bajaron los mandatos, es cuando bajaron los números. Sabemos que la única manera que una comunidad va a tener éxito es que la comunidad tenga conciencia de lo que está haciendo y que participe en lo que les estamos pidiendo. Son datos muy fuertes, ¿verdad? Que casi el 76% de las personas que tienen el virus son personas que no tuvieron la vacuna. Sabemos 3 cosas muy importantes, ¿verdad? La vacuna, que es muy, muy importante. Sabemos que la distancia social es muy importante y obviamente usar la mascarilla es muy importante. En eso estamos ahorita. Vamos a continuar en lo que pasó en San Antonio, donde ahorita están saturados los hospitales, ya comienzan a tener problemas en serios con la situación médica. ¿Queremos irnos para allá o queremos tomar en cuenta y restar lo que nos está sucediendo? Well, one of the things we learned, and Amir and I talk about that we're going to have to keep moving forward because we knew we opened bars, we opened restaurants, but everybody wore the mask and the numbers went down. And so I don't think that we're in a position, and it's really difficult for the community right now to go backwards. So we don't need to go backwards. So there's a case they were telling us about 12 executives and one had COVID and they all wore masks and they were together in a room for 3 days and nobody got the COVID. So we know that by wearing a mask and by being the hygiene component and being vaccinated, we don't want to go back and slow down the process of getting our economy. And just one of the initiatives should be, if we control the virus and if we're able to do the things we want to do, the chances of opening the bridges are going to be greater. If we start having, once again, an uptick on all of this, the chances that we don't open the bridge and we're going to be, I've always said this is a fictitious relationship that we have with Juarez because we don't know how to work if we're not all working together. So we're all looking forward to this, and I think the community will have to take responsibility.
You know, and it's, when you talk about going backwards, we need to continue to know that by doing the right thing, we won't go backwards.
Exactly.
And our community's been able to do that. You know, today, our hospitalization rate is up, and it's up because people have been getting, they put off a lot of the surgeries, a lot of the medical procedures that they needed to do. So our hospitalization is up. And now when COVID numbers start going up, that's really starting to put a stress. And I can tell you that we talked about that today, and there's a stress on the medical system already today. And our medical providers and our first responders are the ones that are out there, and we really do need to think about them and make sure that we keep them protected. And you know, we're not looking to go backwards, but we're also going to make sure that our community continues to be safe and our first responders and medical providers are safe. So we'll look at it on a, you know, could it be an hourly basis, a daily basis? It's something that it's really important that that's our responsibility to make sure we do that.
So this is a little bit more off of this question, but in CDC website, there is a map that shows the majority of counties in the red zone being high levels of transmission. El Paso is orange, so that means it's not as bad. I know we've been doing a lot regarding the vaccination rate here. But what will you do? I know you said you're reaching out to younger people, but just to ensure that El Paso will not get into that red zone, we're just trying to do our best to make sure that we won't get to that point where other counties like Austin,
One of the things that we're real proud of is the amount of preparation that we have when you look at OEM and Chief D'Agostino and Chief Rodriguez and Chief Esparza. I mean, our preparation is unparalleled. I mean, we really work hard prior. We're meeting every time. We meet once a week. We talk about what's going to happen. Digging in, the mayor and I digging into the studies that we have, where are some of the areas that are vulnerable, really getting into there. We're not going to let you down. I mean, I know the mayor and I is very dedicated to do everything that we can to identify it. And as you've always said, you can't solve the problem if you don't define what it is. And so we're looking at every angle.
You know, and exactly what he said is we got to define the problem and then know where it is, and then come to you, the media. You guys are so important to us today to be able to get the word out. And, us just having a meeting and understanding it is great, but being able to communicate and let the public know is equally as important. So you guys, the media today, are really important to us to make sure that we keep our community safe.
Sí, pues es algo que siempre ha dicho, ¿verdad? Nos ha dado ciertos niveles que tenemos que ser los responsables, pero como les digo, no hay algo singularmente que diga uno, si pasa esto, vamos a hacer esto. Tenemos que ver nosotros qué tan rápidos son los casos del Delta, si son 3 o vienen 6 más adelante, qué va a pasar de aquí al lunes. Hay muchos factores, los hospitales, como dijo el alcalde, de que ahorita estamos un poco saturados de pacientes que no tienen nada que ver con COVID, que se demoró el tratamiento. So, tenemos ciertos factores que son independientes, porque si ahorita, siempre ha dicho, si ahorita tenemos un pico, vamos a llegar más rápido a saturar los hospitales. En julio estamos como en 50% capacidad, ahorita andamos en 87% de casos que no tienen que ver nada con COVID. Entonces, estamos vulnerables, apenas las funerarias están haciendo lo que necesitan hacer. No queremos regresar a esa situación. Yo creo que la cosa más triste es lo que sucedió de no poder a nuestros seres queridos que fallecieron y no los podíamos ver. Yo necesito, y el alcalde necesitamos que se quede esa impresión de lo que hemos vivido, pero que no se les olvide, que no se nos olvide de dónde venimos, porque no queremos regresar a esa situación.
And with that, we'll do one last question. Well, all 3 of them had very mild symptoms. and all three of them have been in quarantine, and they have not experienced huge symptoms, which is great. And but we need to make sure that as we look and we read, not everybody's been that like. Yes, and one of them was hospitalized because they had mild symptoms, and they're out of the hospital and doing quarantine at home. So none of them have been have any symptoms that they needed respiratory therapy, or they needed to go in the ICU, or they needed any type of ventilators. They all have gone home, and they're all quarantined and doing well, thank goodness.
Yesterday, President Joe Biden called on local governments to incentivize Americans to get the vaccine in their communities. Do you plan to walk those dollars that are available in your guidelines, whether cities or counties get vaccine?
Well, we're looking at every possibility. We don't have I don't have a tremendous amount of faith that a campaign ever works. Campaigns start and finish. And it's not something that starts and finishes. It's something that we need people to be we need that collective consciousness that allows us to move forward. We could give all the money and tomorrow everybody's back and then the booster comes in and we have to do a campaign. We're not a community that needs to do that. You know, we're about to come into our second year of anniversary of the Walmart tragedy. It's a community that's very vulnerable right now, and we don't need the situation to happen. And I think people need to realize that it has to come from within if we're going to do some of these things. We're willing to try anything. We're willing to try whatever it takes. But personally, campaigns have never worked. They have a start and a finish to them. And this situation has no finish. I mean, this is a marathon, not a sprint.
And you know, it's someone asked about the incentives, and I tell people there is a bigger incentive to look back and see all the lives we've lost within our community. Just about everyone in here, I think that you know somebody that's been impacted by COVID-19. You may even know somebody that's lost a loved one. There's not a bigger incentive than that. And there's not a bigger incentive to be able to look back and say, wow, we don't want to go back to October. We don't want to go back to November. We want to make sure we continue to be one of the safest cities in America and protect our family members and our team members. So it's really important that we look back and know and respect the ones that unfortunately lost their lives because of this horrible disease. And I think that's a huge incentive for all of us. And with that, thank you all for being here. And Mr. Costa, thank you for putting this together in just a very quick moment. And we'll continue to do that as we have any information we want to be able to share, because you all are so important to us to be able to get that information to our community. Judge.
Thank you. I'll just say, don't forget the testing component. We've dropped a lot in testing, and we're not going to find out if we have the variations taking place. Go back to testing. You don't feel good. I mean, the testing is free. Get tested. Make sure that we don't drop those numbers, because sometimes we don't have the right indication of what's happening. And because it's a very almost asymptomatic, we want to make sure we know who's getting the variations and how fast our positivity rate. So testing, we need to get back to testing as one of the key factors. That's one of our learning. We don't test, we don't know what's happening. So thank you, Mayor.
Thank you, sir.
Thank you, Mayor.